Hi, this is Dr. John McCormick, and welcome to the Pulse of Healthcare. And we're going to do our podcast today is a little bit of meeting the staff. We're going to talk to Hannah. Hannah's been an employee over here at Ovation Health for about 4 months, maybe a little more, give or take. And working at our front desk, taking care of member services stuff, and we're just going to kind of chat a little bit, get to know Hannah. So, Hannah, where are you from?
Hello, I am from Houston, Texas, Spring, Texas to be a little bit more exact. And now I'm here,
All right. Where'd you graduate high school from?
Spring High School.
So
Yes,
local resident, spring. We talk about a lot of our services being, hey, we're local, we're Texas.
right.
We don't outsource that to, some foreign country. When you call into Ovation Health, you're talking to somebody that's right here in the great state of Texas,
That's right.
and we service people everywhere.
hmm
Right. So what's been your experience so far working with Ovation Health?
Um, for my first time getting out there in the world, it's pretty nice. It's pretty nice. A different walk, I guess you could say. Health insurance. I wanted to be in insurance before I even got this job, but yeah, I think it's a good transition from regular retail jobs into the medical field, and so far so good. I don't really have any complaints. Not too many crazy people. No, I'm serious.
so, so what does it feel like when you get one of our members on the line and you're able to actually help them meet their needs or get them the direction they want? How does that actually feel?
It feels really good, especially knowing that I actually work for a really good insurance company and getting to connect with members from everywhere. You can really feel the connection because I have time to sit there and talk. I don't have to be rushed or anything like that. And yeah, it feels good knowing that I'm helping the people that are our members and knowing that we're doing something good and we're not like these big companies trying to get over on people. It's good to be able to get on the phone and actually connect on a personal level and get to help people out that way.
So you would say then that we certainly don't treat our members like just a big one number, right?
Right, just like a quick in and out call. What do you need? Get you in, get you out. It definitely doesn't feel like that. I've worked in places where it was like that. Work as fast as possible, get these people in, get these people out. It's definitely not like that here whatsoever. Some members, we hear from them multiple times in 1 month. Sometimes we get calls back from members just thanking us for always being there and being so attentive. And it's really nice to know that these members have an insurance company where they have that access of an actual person that wants good for them as well.
So we talk a lot about that, and we talk a lot about, unlike a lot of other plans where it's kind of an us versus them scenario,
Mm-hmm.
or we're trying, or you feel like you're in competition. That we really are in collaboration. We're
Mm-hmm.
a physician-founded organization. We work really hard to with our members to make sure that they're getting the best possible care,
Right.
with the best possible, providers that
Right.
are out there. And we're fortunate enough that we have a lot of experts that work with us that can help, guide our members to that level of service and that
Mm-hmm.
level of care. We talk a lot about our concierge services. So, would you say that when members call in, they're able to, get their needs met?
Absolutely. I think we get a lot of calls where members are just um, ready to sign up. They know exactly what they want, and I feel like we give, you know, people what they need, the lab services that they need, things that cost, so much amount of money, focusing on like the smaller things that preventative that won't go further than a hospital bill or emergency room bill or urgent care bill or whatever it would be. um, yeah, I love when members call and ask what exactly are is all in your select plans. What exactly am I getting if I commit to being with you guys? And every single time it's always a hit, you know, always exactly what they need, and love explaining it, love getting it across, and everything like that.
That's awesome. So let's switch gears a little bit. So, like I said, you just started here a few months ago. What would you say the culture of Ovation Health is?
Definitely upbeat, I would say. Definitely, I would say joyous, to be, just to say the slightest. I feel like it's not so high strung here. We're not tense. It's not, I don't have a problem coming into work as if, my previous jobs where it was like, here we go again with this, coming in here and everybody's on the same page. Everybody has the same goal. And I think that helps a lot when everybody has the same goal and it's such a positive goal on top of that. And I think it just really carries out through the whole entire office.
So what would you say that goal is?
Helping members out, making sure that whatever stress that they have medically can be, lightened at any cost possible, because it is already stressful to have medical issues nowadays. And I feel like everybody in this office, our goal is to be, how can we make it less stressful for our members? I think that really is our goals, and everybody in the office plays their part.
That's pretty amazing.
Yeah.
I just to full disclosure, I just went up to the desk where Hannah was working and said, "Hey, come back and do a podcast with me." And she's like, "Okay."
Yeah, I didn't really question it. I'm just like
totally extemporaneous here, So kind of cool,
Yeah.
cool. And no pre-review questions. I'm just throwing out whatever came on my mind.
Yep.
To her. So what do you think your next step is? What do you want to do next? I mean, I know you just got in the healthcare space. I knew when we interviewed you a few months ago, you said you were interested in doing this. We're an organization that's about learning. It's about growing. You know me, I'm all about education. What's Hannah's next step?
I think I'm just going with the win right now. I'm happy where I'm at. I'm happy to move up in the health field, and I'm just happy wherever I can expand more, learn more. I learn something new here every single day, so as long as I can continue that and just see where that takes me, I think I'm pretty good. I'm pretty fine with that, because so far so good. I've been here for 3 going on 4 months.
Yeah, I think you're in your 4th month.
Yeah,
4th month right
fourth
now.
going on 5th probably. And yeah, if I just keep pushing myself the way I have been and learning new things, I think I just keep going up from here.
That's awesome.
Yeah.
Well, everybody, that was our podcast today, meeting the staff with Hannah, one of our newest members. She's here. She's available to take your call. She's pretty amazing, and what she doesn't know, she'll learn over the next few months.
That's right.
Thanks for coming out, Hannah. Appreciate
No problem.